My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to D.O or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Aaron Plummer. I'm a pre-med student at the University of Central Florida, and you're listening to the Do or Do Not podcast. This week, we are joined by Dr. GinaMarie Papia, a remarkable physician who will speak to us about the field of integrative medicine, which combines a deep commitment to both traditional Western medicine and complementary approaches to healing. Dr. Papia will share her journey to becoming an osteopathic physician, highlighting how her values and the philosophy of osteopathic medicine aligned with her career goals. Dr. Papia will then discuss her experiences at Lake Erie College of Osteopathic Medicine, including the hands-on, problem-based learning approach that she feels shaped her education. Finally, she'll provide insights into her decision-making process for an internal medicine residency and how she ultimately spent an extra year in an integrative medicine fellowship. Dr. GinaMarie Papia's experiences offer a unique perspective on blending traditional, complementary, and alternative medicine in an integrative way. We know her story will motivate and provide you with fresh insights as you continue your own journey. Please enjoy.
GinaMarie Papia, thank you so much for being with us tonight.
Hello. Wonderful. Thank you for having me.
All right, GinaMarie, we're so excited. Dr. Michael Foti, who was an awesome guest, reached out and recommended that we have you on, and sounds like we're going to have a great conversation.
Yes, I'm very excited. Very excited.
Can you tell us, we want to talk to you about integrative medicine. So can you tell us a little bit about what integrative medicine is and why someone would reach out to an integrative practitioner for care?
Absolutely. That's a great question. And one that I get so often. So integrative medicine, what that means to me is it's Andrew Weil, if anybody knows who he is, we spoke about this. He's the father of integrative medicine. He describes it as just plain good medicine. It's bringing the best of all different healing modalities into one place. And so that's looking at all of the things we're taught in allopathic medicine, all the medications, all the different, treatments, but then also looking at things like natural supplements, stress and stress mediation techniques, looking at how are you sleeping, how's your diet, and kind of interweaving all these things. And that also includes things like acupuncture, traditional Chinese medicine, Ayurveda. There's so many different facets of healing. So that's what integrative medicine is to me. And then to answer your second question, who would look for an integrative medicine doctor? I would put them in two specific buckets. One would be people who want to focus on preventative medicine. They say, I went to my primary doctor, we did a bunch of different blood tests, everything was perfectly normal, but I want to know how can I optimize my health to be the healthiest I can be and maintain this. Or number two, someone who has a health problem, whether it's chronic pain or, debilitating anxiety, and they're just not finding the treatments that they're looking for with their doctors, and they're looking for other different modalities that their doctors may not necessarily be well trained in having a conversation about. So those are the two main ones.
So that sounds amazing. And I just want to start, I don't know that much about integrative medicine, but I actually started down my path into osteopathic medicine with Andrew Weil's book, Spontaneous Healing, which is one of his early books that talked about the way that he started as, I believe, and maybe you'll correct me on this, but started as an herbalist or working with plants. And then I believe he went to Harvard Medical School and ultimately went on this path to look into different types of healing. And in that original book, Spontaneous Healing, his first chapter is titled In My Own Backyard, where he comes upon osteopathic medicine and feels that this doctor named Robert Fulford is an amazing healer who's in Arizona, where I believe Andrew Weil started or is now, and really talks about how he feels how he exemplifies osteopathic medicine as an complementary modality. Can you talk a little bit about the history, if I just
Mhm.
totally messed it up,
Yeah.
of integrative medicine, Andrew Weil specifically, and where
Mhm.
osteopathic medicine sort of plays a role?
Yes. So I'm not specifically sure about Andrew Weil's exact history, but I know that, yes, he did go to Harvard Medical School. Yes, he's trained as a botanist and herbalist. And he went, like you'll hear a lot of physicians when you read books, they go to different countries to look for healing modalities. They go to Asia, they go to South America, looking at indigenous cultures. What are they doing for healing? And he did all of that. And then he came back to where he was from, whether it's in Arizona, and just around the block, right? There's an osteopath there doing osteopathic medicine. And there are these healing traditions that are native to this country, right? They came from here, really grassroots in America. And it's just amazing to see how that was literally right in his backyard. And then from this, he basically became what we call like the grandfather of integrative medicine. The main place to get integrative medicine training is still the Andrew Weil Center at University of Arizona. They do a whole fellowship program, and that's kind of the has been the cornerstone. And then the different fellowships have kind of spurred off of that. And so that's really where it started.
Yeah, that's super cool. So can you tell us a little bit about, now we're going to talk about your medical education, but you did
Mhm.
internal medicine training
I
prior
did.
to becoming interested. And
Yes.
actually, I'm gonna take a step back. Can
Mhm.
you I was once asked, and tell me what you think of this. I was once asked on an interview
Mhm.
that whether I think it's important for DOs such as myself who don't practice complementary medicine to get osteopathic manipulation as a class in medical school. And my opinion and my response was that I think it's super important, even if you don't practice it, to have an appreciation for different modalities. Do you feel that your training as a DO helped you with that, or do you think you would have done the same thing if you had gone to an allopathic school?
I completely agree. I think even if you don't go into a tradition, right, if you're not practicing osteopathic manipulation, there's still benefits in learning the framework of right structure and function. You may go in as a surgeon, right, and you're doing surgery, but if you have that in the back of your mind that that was something you learned, you understand how things are interconnected, it may inform just how you interact with patients, how you know, understanding that the body's a whole, treating the person as a whole. I think it's really important.
So GinaMarie, going back, can you tell us, so
Mhm.
you trained as an internist, right?
Yes, I
Okay, and
did.
then
So
tell us, yeah.
yeah, I can tell you. So I knew, so I'll give you kind of a loop of how I ended up at DO school. I can kind of tell you a little bit about that. So I
Let's
went to,
stay
okay,
with
good.
the integrative. Yeah, stay with the integrative medicine.
Okay,
Let's go back. Then we'll go back. So
okay.
tell us about after you finished
So
internal
internal medicine.
medicine, how you
Yeah.
decided that you wanted to pursue integrative medicine and how you found how does somebody find a program in
Mhm.
integrative medicine?
Yes, that's a great question. So I did my internal medicine residency in Greenwich, Connecticut, and that's where I met Michael Foti. We were in our class together, so we did all the years together. And I knew I was interested in acupuncture before I went to medical school. So I always had this kind of propensity towards understanding all different healing modalities. And when I was in medical school, they had an integrative medicine club. I didn't really know what that was. But then when I went to the meeting and I learned more about it, I'm like, wow, this is exactly how I want to practice. I want to learn more about nutrition. I want to learn more about healing. So that kind of spurred that. And then I knew that I wanted to do outpatient medicine. So I knew I was going to do either internal medicine, family medicine, and ultimately decided to do internal medicine. And when I was during my internal medicine training, I was looking for opportunities, even though we were during COVID, we were interns. So there was a limited opportunities to really learn. But there was an oncologist in our kind of area that practiced integrated medicine. I rotated with him. I did an elective with the University of Arizona that was virtual. I did functional medicine course that was during, I tried any way I could to kind of incorporate that into my residency, and thankful to the people who were in my residency. They were very understanding about that. And then when I knew I wanted to learn integrative medicine. I knew about the Andrew Weil program that was in Arizona. I also knew that that was one that a lot of people do when they're they're working, so they'll do it part-time, and there's not really a lot of clinical experience. Usually we'll do a couple of weeks of clinicals. So I was looking for an opportunity where I can go somewhere and do integrative medicine and actually be immersed in it and learn and see patients, because I felt like that would be the best way to learn it. So it was actually through a friend of mine in a different residency program who said that a senior in her class was doing an integrative medicine fellowship in California. So at that time, I didn't even know that there were in-person fellowships, but I spoke to that person, that opened the door, and I just started searching. And that's where I ended up finding the program for integrative medicine at Northwestern that I ultimately ended up attending.
That sounds so cool. So now that program, was it a year? How long was that program?
Yes, so it was a year long that I was in Chicago at Northwestern. They actually have an academic center it's called the Osher Center for Integrative Medicine. And it's basically a family that donated a lot of money, and they made this foundation that's opened up these different Osher, what they call Osher centers for integrative medicine at different academic institutions. So Northwestern was kind of the pillar of them. And I got to learn under one of the people that's literally written in the textbook for integrative medicine. I got to learn under Dr. Melinda Ring, and I spent a year there, and I did a combination of integrative medicine consults at the clinic there. And then we were also working in an FQHC serving the underprivileged. So it was a great experience.
So now, were there other doctors there with you, or was it just you as the fellow?
So I was the only fellow there, and I was the only fellow they had for a while because of COVID. They didn't have a new fellow during that year, so it was just me. And then there was Dr. Ring, and then there was another doctor there. So 2 integrative medicine doctors, but within a clinic that had an acupuncturist, a massage therapist, a chiropractor. So it was a kind of, and primary care doctors too. So it was a nice combination.
So now what modalities, just so, we could really sink our teeth, Andrew Weil, obviously we just discussed, was a botanist, or, used natural roots and things that he found in his garden or that he grew. Like, did you learn those things? And what other modalities did you learn during that year of integrative medicine?
Yes. What I think I learned best was natural supplements, because I think that's something that a lot of people are interested in, but especially physicians. We're not trained to understand, how do you know if it's a good product or not? How do you know if it's safe? How do you know, where do you look up interactions, things like that? So I became very well versed in natural supplements, that being vitamins, minerals, herbs. Not quite going to the yard and picking them and then bringing them for the patients, although that would have been pretty cool. I did actually, there is a program in Connecticut that one of my mentors worked with. I don't think they have residents or fellows anymore, but they had a garden in the back where they would go, you could pick things. It's pretty cool. But this is the field of integrative medicine. It's to have a garden in the back, and that's normal so that you can meditate and things like that. But other than that, we also learned all the different kind of healing. So we learned about yoga and the impact on different health. We learned about Tai Chi, like physical movement. We learned a lot about nutrition. We learned OMT was even in the movement section, and understanding different ways that are like chiropractor. They kind of lump OMT and chiropractic together, which I know some people will have a point of contention with, but it was interesting to see the differences and kind of compare and contrast them. We learned about, let's see, what else am I missing? The impact of sleep on health, the impact of diet, the impact of physical activity, how to prescribe physical activity, basically all the things that you would want to know if you're going to do a really exhaustive way for somebody to be really healthy.
And now talking about what specific types of patients you treated. Now, these people that were coming in that had cancer and were failing, or are these people that were just seeing a Western physician and just were not happy with the treatments they were given, or these people that just didn't believe in Western medicine, like, or a combination of those?
I would say it was a combination of a lot of them. We did see cancer patients, and usually it was pretty early on in the treatment where they were looking for, what else can I be doing other than the chemo and things to help my body recover. We also would see the people who, don't believe in Western medicine. So treating them in a way that was, aligned with their beliefs. And then because we worked in an academic center, a lot of the referrals were coming from other doctors within the system. We ended up getting a lot of the patients that nobody else really knew what to do with. So the patients that have chronic pain and nothing's really helping, or, fibromyalgia, different types of disease processes, that the lifestyle that's underneath it is really what needs to be looked at. And we were able to have more time with them to really start to unwind things. And I would say, and even gastrointestinal things like IBS, where nothing's really wrong on all the testing. And they're just like, I just want to know what else I can be doing.
It's very interesting. And then as far as, when we talk integrative, obviously we use these words sometimes interchangeable, alternative and complementary. Would you say, right? So, and they're different terms. Would you say that integrative medicine, and specifically the integrative medicine that you trained in as an internist, was complementary to standard therapy or an alternative to standard therapy?
So initially, when this field was developing, the terms complementary and alternative medicine were used as the primary way to explain it. The term integrative medicine came along as an evolution where it really, how we want to explain it is the best of both worlds, right? It's the best of alternative and complementary and allopathic medicine, right? It doesn't mean that I don't prescribe medications or I don't recommend surgery or treatment. It's bringing them together and finding what is the best plan for the person sitting in front of me that aligns with their values, aligns with their goals, and can get them to where they want to go.
Very cool. Super cool. All right, GinaMarie, let's turn it back a little bit. Tell us where you grew up and when you decided you want to be a doctor.
Okay. I grew up in Queens, New York. Actually, still live in Queens. I grew up actually in Forest Hills and currently live in Whitestone. So Queens, born and raised. I think that's why Dr. Foti and I got along so well. We had the Queens and the Bronx, and we really connected. I grew up in Queens. I went to college at NYIT, which has NICOM, NYIT Com, which is the Osteopathic Medical School. That's where I first learned about what an osteopathic medical school was. I did not think I was going to be a doctor when I started school at NYIT. I thought I was going to be an interior designer. And I actually went there for their architecture interior design program. About a year in, I was like, this is not for me. I wasn't enjoying doing the drawings, having late night doing all this different stuff. It just wasn't for me. I always enjoyed my science classes. I found it very interesting. I had friends of mine who were in my English classes and those kind of common curriculum classes who were doing pre-med. And I'm like, I could do this. I'm like, I think, and I kind of switched and it just became like one thing led to another. And I'm like, I'm really enjoying this. And ultimately decided I wanted to go to medical school. But I also had this kind of inclination. I'm like, should I go to medical school or should I go to acupuncture school? Which is an interesting kind of trajectory. And how I made that decision, it goes back to how I kind of got interested in acupuncture together. I met an acupuncturist who really helped my mom. And he told me at that time, I was like, I'm really interested in learning more about acupuncture. I'm thinking about going to acupuncture school. And he said, if the only thing I would have done differently is like, I would have gone to osteopathic medical school. And I took that very seriously. And one thing kind of led to another. And ultimately I decided to go to osteopathic medical school.
Now, what was your feeling about, so you're at NYIT, they have a com there, right?
Yes.
Your acupuncturist mentor tells you to go to DO school. Did you interact with the DO students before? Did you know anything about the school? Were you fully versed? Like how was that like before you applied?
I would say very slightly. Not much interaction with the DO students, although they did have an accelerated program within the college that was a lot of the kids that I was in classes with were in the accelerated program that would go right into the DO school. So I would say maybe I interacted with them before, but I don't think I fully understood what being an osteopathic physician meant until I started doing research when I was going to apply. And the philosophy felt like it was aligned with me. And then also once I went to medical school, it was like one thing fell into place after another. I just felt like, wow, like this is where I'm meant to be. This makes so much sense. It feels so aligned with my values. And I was very happy with that decision.
Now, did you look around at different comms or you just like, look, I'm at New York Tech. They already have a comm. I'm just staying here.
I did the worst thing that I did, like no preparation. I applied to a handful of schools, which now I know is a terrible idea, right? People apply to like hundreds of medical schools. And by the grace of God, and I just feel like I was in the right place at the right time. I got accepted to LECOM Bradenton, Lake Erie College of Osteopathic Medicine in Sarasota, Bradenton, Florida.
Oh, so
and
So you went to Florida. So you
Mhm.
applied, you got into Florida. That's where you're going, Bradenton.
Yes, that's where I went. Yes,
Okay.
yes.
Now tell us a little bit about that just because
Mhm.
we haven't spoken to anyone that's been there. Tell us what the school is like, tell us what the area is like, and tell us what your education was like there.
Yes, I will. So, Lake Erie College of Osteopathic Medicine is based in Lake Erie in Pennsylvania. The Bradenton campus is a satellite campus of that. It is a totally PBL, well, when I was there, totally PBL program. So it's problem-based learning. So we had very few lectures. In the beginning, anatomy was a lecture and some other things, but primarily we learned by case-based studies. So we would have a group of 6 to 8 students in a room with a proctor, a preceptor, I think they would call them a proctor, and we would go through cases. And so they would have a case about a patient, all the different symptoms, their lab values, and imaging, and we would kind of ask for things as we went through. So you're really learning hands-on, and then based on what we were seeing with the patient, we would pick chapters in biochemistry, in anatomy, in all the different textbooks, and that's how we would learn. So that was, I honestly, I loved it. It was a wonderful way to learn. I feel like I got a lot of experience. And to answer your questions about the area, it's Florida. It's absolutely beautiful. It's miles away from the best, what's considered the best beach in America, which is in Siesta Key, which is, we would go there, not very much, but after exams. And it was overall a very positive experience. I mean, as positive as med school can be, right? It's stressful,
Right.
but
Exactly. You
it's
don't
great.
enjoy the beach
Mhm.
that much while you're in medical
No,
school, obviously.
no.
So tell me, like, as far you're already into complementary medicine from
Mhm.
acupuncture, did you seek out extra OMM? Were you really into OMM while you were there? What was your feeling toward osteopathic manipulative therapy when you were at Bradenton?
So I would say the teachers that we had there were phenomenal, and I loved learning it when we were in school. And I wish I did more of it now. But I honestly, the only people I treat with OMT now is my family members. When somebody has pain, I have my table downstairs. It kind of was one of those things that fell off. I did it during the first 2 years. During my clinicals, none of the doctors that I rotated with or the hospital systems really practice it. So there was an opportunity to actually treat patients with it. And then unfortunately, during residency, we didn't have DOs in our residency program that were trained to do it. So we didn't even have the opportunity to use it in clinic or experience that too. So it kind of was one of those things that kind of fell off, unfortunately.
So GinaMarie, you started off in Queens. You're a Queens
Mhm.
gal. You do your pre-med years on Long Island. You go to
Mhm.
Florida for
Yep.
med school. Tell us a little bit about what type of rotations, like where did you do your rotations, and then
Mhm.
from a branch campus in Florida, and then how did you decide on internal medicine?
Yeah. So what's interesting about the rotations that were with Bradenton, at that time, they were sending students kind of all over the country. They had different locations. And we had the opportunity, which I don't even know if this would be able to do this now, to set up our own rotations, which I feel like for me, that was like a life lesson because it ended up being a lot of I would literally cold call different places to like, are you open to having students rotate? Which is it's a burden to put on your medical students. But I knew at that point, after 2 years, that I wanted to be back in the Northeast. I wanted to be close to home. So I made that a priority for myself, that I was going to make that happen. So ultimately, I did a combination of some hospital and a lot of outpatient practice during those rotations. I was able to, there's a hospital up here in Queens that is actually affiliated with LECOM called St. John's Episcopal, that I was able to do my emergency medicine, surgery, wound care, did a bunch of rotations up there. And then I did a lot of, actually some rotations on Long Island. So it was a good mixture of things, kind of all over the place, all over the place.
And how'd you decide on internal medicine? Did you know right away that's what you wanted to do? Is that a tough decision?
It wasn't, I wouldn't say it was a tough decision. There were certain things that I enjoyed. I knew, like, I enjoyed doing OBGYN. Like, those rotations were fun because, delivering babies. But at the end of the day, I'm like, I don't want to get up in the middle of the night. I don't want, it's beautiful when a baby's being born, but then, if things go wrong, it's very scary. So I knew that wasn't for me. And then I knew I wanted to practice outpatient medicine. So I was either family medicine or internal medicine. And ultimately, at that point, I wasn't 100% sure in the direction I was gonna go as far as if I was gonna pursue fellowship. And I just felt if I did internal medicine, I could do cardiology, GI, nephrology can kind of go in any direction.
That's great. So you decide on internal medicine, and now you're applying. Tell us how you decided on a program, what area you wanted to be in, what you were looking for in a program, and how you ended up with Michael Foti.
So I got much more organized from my med school application days to residency. I read this. There is a book. It was incredible about applying to residency that I can't remember. It's has like a burgundy cover. I read this book cover to cover, all of everything you need to know about applying to residency programs. And this time I did it the right way. I knew I wanted to be in the Northeast, close to where my family is. I applied within a certain geographical radius of that area, and I kind of applied to all the different programs. And what I was looking for in a program was pretty much location was big for me. Like that's, and then basically I did it. I applied by location, and then based on the interviews is how I decided if I actually wanted to rank those programs, because you learn a lot during those interview process. You learn about the residents. There was one residency program, I don't even remember where it was, that we didn't see the residents the whole time. And I'm just thinking, I'm like, this is a bad sign. If you're coming for an interview and you don't see the residents, which means they're probably exhausted or like hiding in the basement somewhere. It's terrible. And so you learn a lot. You also get a feel, are you comfortable with the people running this program? Do you feel welcome? What's the culture like? And I remember when I interviewed at Greenwich, first of all, I was almost late because there was a bridge that opened on the turnpike here, going up towards the Bronx. And they literally opened a little bridge, and the highway was a dead stop when I'm driving to a residency interview. So stressful. I made it there in time. What I loved most about the hospital, first of all, it's beautiful. It's in this like beautiful town in Connecticut. It's a very small hospital. It has a very nice feeling. But what I remember the most is walking through the hallways. And as you're going on the tour, everyone that passed you, see, good morning, good morning. And I don't know if it's because I'm from Queens and it's not normal, right, for you to walk past people on the street and say good morning, but I loved it. I was like, people are so nice here. This is where I want to do my training. And so I fell in love with it during my interview during that process, and ultimately ended up to rank that first, and by a blessing ended up there with
Awesome.
Dr. Foti.
Awesome. So now, did you go straight into the integrative medicine program after you finished?
I did.
Okay. And then tell us,
yeah.
After you finish the integrative medicine, tell us about your journey to where you are now through practice.
Yeah, so I did integrative medicine straight from my residency program. The application process is a little different because it doesn't go by the match where a lot of the fellowships do, or in that match program. There were only maybe 5 programs in the whole country that are actually doing in-person integrative medicine, and you apply separately. Each one has its own application. And it's not like they all kind of come to fruition at the same time. I had my interviews very staggered. So ultimately decided on Northwestern, and I moved to Chicago. So I went from New York to Florida to Connecticut to Chicago. I was there for a year, and then I moved back to New York. And so I finished, when was that? I ended about August of last year, and I decided to move back to New York. And since then I knew I wanted to be in private practice. It was important for me, especially from an integrative medicine lens. You need to have time with the patients. And I knew that being in a big hospital system for me, that autonomy wasn't going to be there. And I knew that that was important to me. So I had a mentor that is an endocrinologist who's here in Queens that I shadowed with before I even went to medical school. And he gave me the opportunity to work with him in his office. And I've been doing a combination of endocrine, practicing with him, and then also seeing patients for integrative medicine. And it blends very nicely together.
So now some people say, first of all, I kudos to you. Amazing to start your own practice. Obviously, you have some help from your mentor, but some people say, some docs say you can't do that, right? Did you hear that? Just going down a little rabbit hole. But some doctors say private practice, you can't do it. Starting up a practice, can't do it. Like, how has your experience been so far? And what would your advice be to a doctor coming out that's thinking about maybe going into private practice and specifically maybe starting up their own venture?
I would say this is If we're looking at medicine as a whole and we see so many doctors being so burnt out in hospital systems and these different practices, there needs to be a rebirth of people being in private, of doctors being in private practice, of owning their own time. So I would say it takes grit. And I have my mentor, so I'm kind of working in a practice that's already started. But if there's one thing that I could tell myself 10 years ago is like, don't be afraid to make it your own. I think in medicine, we think we need to fit into like these little boxes of what it looks like to be a doctor. And I think it's important to understand that this is your life. You need to be able to make it your own. It needs to work with your life. And you can serve patients so much better when you're working from a place that feels aligned with what your values are. So I would say go for it. If this is something you have on your heart, it's definitely possible. I think it will get easier with technology when we're able to kind of streamline things a little bit more, but definitely still worth it.
All right, I think that's awesome advice. I would echo that personally. I think that's great. And again, I applaud you for doing it. GinaMarie, it's been a great discussion. Our last grand finale question, which you already gave us some advice, but can you give us one piece of advice that you were given from someone else that you feel has been really impactful in your career and you would like to pass on to our listeners?
Oh my gosh. It's funny. The advice that I got is actually from someone I think you interviewed, is Jordan Keys, she's like an OMT goddess. This woman has like magical hands. She was teaching at Lecom Bradenton when I was there. And she told me, I remember my roommate and I went to her during a time it was very stressful. We were taking exams and we were looking to go to her for some comforting advice. And she said to us, she said, I can't tell you that it's going to get easier, but she said, I promise you that you will get better. And that has never left me because that is the truest thing that I've ever heard. As you continue on this journey from pre-med to medical school to residency and all those things, it doesn't get easier, but you get so much better that you're able to take on these things and you'll be doing things you never could have imagined you would be able to accomplish and do even 5 years ago. So for me, that was something that always like really sits with me. Very important.
That's great. I love Jordan Keys also, and I think that's spectacular advice to pass on. So GinaMarie, thank you so much for spending time with us tonight. I really do appreciate it.
Thank you for having me. It's my pleasure.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.